Everybody. For today's lecture, we are going to be focusing on the axial skeleton. We will be looking at the bones that are associated with your skull, with your rib cage, your sternum, the vertebral column, and we're also going to look at the structures that are associated with each of these bones. So let's go ahead and get started. In this picture, what we're highlighting is the axial skeleton in that kind of greenish color. Again, you have the skull itself that is made up of 26 separate bones. You have the sternum, which is also known as the breastbone, the vertebral column, which is actually broken down to cervical, thoracic, lumbar, sacral, and fused coccygeal bones, and then 12 pairs of ribs that basically form your rib cage. So let's go ahead and get started with our axial skeleton. I have the information for appendicular skeleton if you guys want to take a look at this, but again, this is going to be our next lecture. Now, before we get started, we're going to get introduced to some terminology that's associated with both axial and appendicular skeleton when it comes to anatomical terminology. So when we're talking about some sort of elevation on the surface of the bone, from the most to the least prominent, so it could be basically very pronounced or just a little elevation, we use terminology such as crest, lines, or ridges. We also can use the word tuberosity or tubercle, which are these rough and elevated or round projections on the bone. They are usually points of attachment for muscles, and they're really important in terms of identifiable marks on your bone. You can also use the words, which are typically long, sharp projections on your bone. And we'll see that a few times as we go through the skeletal system. Articulation simply means the surfaces that are where the two bones come into contact with each other to basically form a joint. So those surfaces can be called facets when usually when the connection is kind of like a two structures fitting into each other's. Facet simply means little face. You will see that in the vertebral column quite a few times as one vertebra sits on top of another. You also have the word condyle and epicondyle. These are usually found at the end of the appendicular bones as they connect together to form the articulations between the bones of the arm and the bones of your leg. Condyle simply means round projections, and epicondyle means when you have two rounded projections, one on top of another one. We also have depressions on the surface of the bone. Again, these depressions can be different. They could be pretty broad and shallow, or they could be pretty pronounced and protruding inside, more like a hole. So if they're broad and shallow, we typically call them fossa. If they are small, they're called typically fovea or pits. If they are long and shallow, they're called groove or sulcus. And as it mentioned, if it's a perforating hole, we refer to them as foramen. Foramen uses a lot in terms of your skull, as we have a lot of holes that are basically when the nerves either enter or exit. And then you have the word meatus or canal, which was basically kind of the hole is digging inside the bone. So you have more of a tube or a structure that is caved into the bone rather than just a hole itself. So let's look at some of the main bones of the skull. The front of your skull is made up of a bone called the frontal bone. The frontal bone is basically form your forehead and the first part or the anterior part of your skull. Majority of the top of your cranium is made up of the parietal bone. There are actually two identical parietal bones that forms the cranium or the superior part of your cranium. And we'll see that in another photo and how they actually come together. The posterior part of the skull, which is depicted in red here, is referred to as the occipital bone. The bones that are forming the side of your skull, again, one on the right, one on the left, are called the temporal bone. Now notice that these bones are actually fused together or connected very tightly together using a type of joint called sutures. These sutures are basically identified as immovable joints. So between your frontal bone and the two parietal bone, you have your frontal or your coronal suture. Between the parietal bone and the occipital bone, you have the suture called the lambdoid suture. And then between this bone right here, this protrusion you see on the side, which is called the mastoid process, and the occipital bone, you have another suture right here, which is called the occipitomastoid suture. Lastly, as is depicted here, it's the suture between the temporal bone and the parietal bone. This suture is called the esquamosal suture. This part of the skull is typically pretty thin. So if you're looking at an actual skull, a lot of times you can actually see the light passing through the skull because the bone is super thin in this region. If you're looking at the superior view of the skull, basically from the top, here is the frontal bone right here, and these two are the identical parietal bone for the right and left. Again, notice right here is the connection or the suture between the frontal bone and the parietal bones, called the coronal or frontal suture. And the suture that connects the two parietal bones together, that's called the sagittal suture. The word sagittal should sound familiar to you because it was also one of the planes that basically we can divide the body based on. Now, as forward, I do want you guys to notice the difference between the name of the bone versus the name of the structures on the bone. For instance, if you're looking at this picture, what is depicted in green is your frontal bone. But the frontal bone itself has marking or structures that are present and easily identifiable. For instance, the area that sits right between your two eyebrows, so right about here, is referred to as the glabella. You also have this little indentation, or sometimes in some people it's an actual hole. It sits right on top of the orbital cavity, and therefore it's called the supraorbital foramen. Again, supra stands for superior, orbital as an orbital cavity, and foramen means a hole. FYI, as we go through the PowerPoint, you can see another hole right here that sits below the orbital cavity. So there's right here and right here, and these are called infraorbital foramen. Okay, so let's go ahead and move on. I'm just putting my pen on so I can show you some of the structures. So right here, if you're looking at the lateral view of the skull, as I mentioned, we have this kind of a very pronounced protrusion right here. This is called our mastoid process. And again, if this is my occipital bone, the connection that you have right here, that's called the occipitomastoid suture. Superior to your process, you have this opening right here. This opening is basically your ear canal. On the external view, and on the skull is referred to as the external auditory meatus. You can replace the word meatus with the word canal because they are interchangeable. You have this sharp protrusion anterior to the mastoid process. This is called the styloid process. And again, superior to that, you have this indentation right here. This is called the mandibular fossa. So if you guys are familiar, the lower part of your jaw is really referred to as the mandible. So this is how your mandible literally fits into your skull. It fits into this little cavity called the mandibular fossa. Now the bone that you see right here, which is what we call your cheekbone, this bone right here is called the zygomatic bone. So this bone here, which is again your cheekbone, that's called the zygomatic bone. And you can see it on the next slide as well, zygomatic bone. Now, zygomatic bone has this arch or bridge that is connected to the temporal bone, right? This is your temporal bone right here. So it's not very clear on this, but there is a line right about here in this picture, and that's a suture, where it allows the temporal bone to join with the zygomatic bone. So if I'm looking at this structure, this part of the picture right here, about here, and I'm sorry, the arrow is a little off. This part is corresponding to the temporal process. Process is an extension of the bone, but it's coming from the zygomatic bone, which is this bone. This extension you see right here is moving toward the zygomatic bone. So it's called the zygomatic process, but it's actually associated with your temporal bone. So in an exam, if I ask you what is the full name for these structures, if it's asking for this part, your name would be zygomatic process, as in going toward the zygomatic bone, but it's associated with your temporal bone. And this one is the temporal process going toward the temporal bone, right? And it's the bone that it's associated with is the zygomatic bone. Here's some additional terminology. Some of these we already discussed, but again, kind of going over what we haven't really touched upon here. We have talked about the frontal, the parietal, the temporal, and occipital bone. We have talked about the suture, esquamoso suture, external acoustic meatus, occipital mastoid suture, mastoid process, styloid process. We just mentioned the zygomatic bone, which is basically, again, here's the temporal bone. You can see it color-coded with this suture separating them. A few new names that you have is the sphenoid bone right here, which is partially visible. This is actually a butterfly-shaped bone. It's kind of like this. And you can see it again on the next picture as well. It's a butterfly-shaped bone that is inside your skull. That's your sphenoid bone. You'll see it internally, but on the external, you only see part of this bone. The bone that forms the bridge of your nose, that's your nasal bone. In the orbital cavity on the side, on the medial aspect of the orbital cavity, you have a small bone. Sorry, it's not a small bone. It's partially being seen from your orbital cavity, I should say. It's called the ethmoid bone, and it actually tracks upwards. So if you look at it position-wise, it's somewhere right here. That's your ethmoid bone inside your skull. So again, you can see it internally when you take out the top of the cranium and look inside the skull. The facial bone right here, this large facial bone we see is called the maxilla. And you also have the mandible, which is the lower part of the jaw. And then we talked about the mandibular fossa, which was this kind of indentation right here where the mandible fits in. Sorry, I just noticed I kind of highlighted this one wrong for you. So it's this one that you see it here. This bone right here is called the lacrimal bone. And I'll talk about that later in a different view for you guys, so you guys get a better idea of it. Now, if I turn the skull around, so I'm looking from underneath the skull. It might be hard to kind of visualize it, but this is the mastoid process, that little bulgy bone on the side of your skull. And if you want to kind of imagine yourself, if you go right behind your ear and touch your ear, you can kind of feel this round bone right behind your ear. That's your mastoid process. So it's kind of easily visual. So imagine, like, if you're looking at it, this is literally protruding out of your screen. And the second one that you see is your styloid process, which was the sharp bone that we saw on the earlier picture. There is an opening right between those two, it's a little hole. And this hole, because it's located between these two structures, it's called the stylomastoid foramen. This view that you're looking at, we're looking at some of the structure visible on the temporal bone. So let me tell you what view this is first. This is looking inside your skull. So I have taken up the top of your skull and you're looking inside the skull. So if you look inside the skull, you see this kind of like a mountain-like structure. So this is kind of like a protrusion out of your bone. And you can kind of imagine it right here. And on the side that is more posterior, so this is the posterior aspect. If I want to orient you guys, this is the anterior view. There are two very visible holes, a smaller one and a larger, kind of more irregular shaped one. The smaller one is the continuation of your ear canal that is opening inside your skull. And as the name implies, internal auditory meatus. So it's the continuation of the external auditory meatus. The more irregular shaped structure you have is the jugular foramen. This is where your jugular vein passes through, collecting deoxygenated blood out of your skull. Now, the actual piece of bone that is protruding, that's a thick piece of bone that kind of, again, look like a mountain, that's called the petroeus portion. So in the same view of the skull, just a little bit more clear, again, this is your anterior portion, this is the posterior, so that's your frontal bone, basically. That's the occipital bone. Here is your temporal bone, right here is your temporal bone. And again, you have removed the parietal bone on this view. So what you have again is this kind of a mountain-like structure poking out, which is your petroeus portion. And then you have your jugular foramen, which would be kind of the more irregular shaped one, and the little opening right on top, which is the internal auditory meatus. Another structure you can see here is this kind of the digging underneath the bone right here. And not the hole itself, but that kind of indentation you can see on the side. So right here or right here where I draw in the triangle. This is where a blood vessel called the carotid artery passes through. So that's because it's digging into the bone, it's called the carotid canal. Now again, to orient you guys on this picture, what you're looking at is you have turned the skull around, so you're looking at it underneath. To kind of help you find some of the structures, again, here is your mastoid process, the big bulgy one that is kind of, you can feel it behind your ear. Here is the pronounced styloid process. So we mentioned there was a hole right here. It's not visible on this view, but it would have called the stylomastoid foramen. So underneath the skull, there's this really big opening. This is where the spinal cord actually comes up to joins your brain. So the opening that is for the spinal cord is called the foramen magnum, basically a big hole, simply means. You also have these kind of two protrusions on your bone, one right here and one right here. They're identical to each other. This is the point of connection to the vertebral column, or the bony part of the skeletal system, basically. These are called occipital condyle, and they connect to the vertebral bones as they come to form your vertebral column. Now, if you go underneath the occipital condyles, you should see two little holes, which is basically where this wooden stick is passing through right here. This hole right here is referred to as the hypoglossal canal. And basically, it's going to go under the tongue. Next, we have the sphenoid bone. So remember I said a sphenoid bone is this kind of butter-shaped bone that is sitting inside your skull and is partially visible from outside. So it still applies here. So here is that kind of a butterfly shape that I've talked about. So here is the butterfly shape that I was mentioning earlier. Sorry, not the best of the drawer, but we're looking at the superior view. That's the one that we're concerned about. Even though I do have the posterior view visible for you guys, most of the pictures that I'll show you, actually all of them, are going to be from the superior view of the sphenoid bone, because that's how it sits inside your skull. So here is the bone on its own. Again, you guys, if you were in the class, you would not actually see this bone separated unless you're looking at an exploded skull. But in a fully formed skull, you actually need to see that from within your skull. So what you have, and I'm going to just kind of go forward in the next picture and kind of show you these structures in the next couple pictures that I have. So right here is basically this butterfly bone that I'm talking about. So I'm kind of going to highlight this area for you. This is the butterfly structure we're talking about, okay? Which is, if you look at this picture and then come back to this picture, what I'm showing you here, right? So this is your foramen magnum, right? Where your spinal cord comes in, which means this is the occipital bone in the back. Up here is your frontal bone. And on the side, we have our temporal bone. So what the structures do we have within the sphenoid bone? We have actually a lot of, we have a lot of foramens or opening inside your sphenoid bone. There are 3 of them that are in line with each other. So you have one up here, one that's kind of oval shaped, and then the third one right here. So in this side, if I'm drawing them parallel to each other, here's one right here, here's the second one, and here's the third. So in order, they're called foramen rotundum, foramen ovale, and foramen spinosum. So I tell my students to remember ROS, a rose without the E. So rotundum, ovale, spinosum. Another way for you guys to remember this is the ovale one kind of looks like oval shape, right? So that's an easy way. So if it's on the top, it's rotundum. If it's below it, it's a spinosum. We also have this single hole that's medial to those. So right here and right here, these are called the foramen lacerum. And if you guys recall earlier, we mentioned this opening or canal on the side that is poking out. That would be your carotid canal that passes on the sides. Now, right at the center of this, we have this little cavity. This is called the hypophyseal fossa for sella turcica. If you're interested what this cavity actually holds at the center, it carries, or it is a place for your pituitary gland, which is this tiny gland hanging from the hypothalamus in your, which should sound familiar to you since we already talked about nervous system in detail. And then coming in front of the sella turcica, you have another hole right here and right here. If you actually pass a wooden stick through the hole right here, it goes and passes through the orbital canal. So if I'm passing literally a piece of wood or a little tiny stick through this hole, it pokes through the orbital canal. Now, what is the purpose of this opening is that this is where your optic nerve, which collects data from your eye, basically passes through to get the information to your brain. So hence the name of this opening is optic canal, as in it's associated with your optic or your vision. Again, here is a different view of the same structure. Again, to help you orient, this is the frontal bone here. This is your sella turcica or the hypophyseal fossa of the sella turcica, where your pituitary gland sits. Here are my 3 holes. 1, 2, 3. Take a moment to see if you remember them. Foramen rotundum, foramen ovale, foramen spinosum. Here, that's by itself, which is also right here. Those were your foramen lacerum. And then the opening on the side would be your carotid canal. Now, right here, you also have this kind of like, to me, it looks like eyebrows. So one right here, and I'm gonna just draw this one too. One right here, these are called the lesser wing. And the area, which is kind of that kind of dip right underneath it, this whole area, I'm gonna kind of shade it for you guys. Right here and right here, this area is called the greater wing. So again, kind of go back to that whole butterfly shape. Okay, so moving forward, here is the anterior view of the skull. I want to kind of just go over some of the bones with you guys to get practice. So if you guys don't feel comfortable, you kind of, that repetition would be our key here. So here is my frontal bone. This is my nasal bone. This is my orbital cavity. Right here is my zygomatic bone. And then again, here's my orbital cavity right here. And if I'm looking at the side, that's my temporal bone. This little opening that you have that I told you earlier, that's the optic canal. So if I continue this one, this will look as this hole right here. So that's basically the continuation. So my orbital cavity is right over here and the hole opens up to the back. You also have this kind of a opening that called fissures because they're very pronounced opening. You have one on the top, one on the bottom. So this is actually open, even though it's not very clear. So the top one, again, it's inside the orbital cavity. So it's called the superior orbital fissure. And the bottom opening is called the inferior orbital fissure. Now, on the anterior view of the skull, again, here's my frontal bone, sella turcica, my 3 ROS holes, foramen lacerum, kind of orienting yourself here, optic canal, here, and right here. So this structure you see right here, that's your ethmoid bone. If you guys recall, I said ethmoid bone actually starts and it's visible inside your skull, where you're basically right above your nose. And then it comes down and it's visible through the opening right underneath the nasal bone. And I'll show you the view in just a second as well. So right here, we have this structure. So I'm just gonna kind of go and form the lines around it. So this structure as a whole is called the cribriform plate. So cribriform plate is the surface. Now in that surface, there is this kind of a protrusion right at the center. It's like a really sharp mountain that comes up. That's called the crista galli. And on the cribriform plate, you have a bunch of holes, and you can see these are very pronounced holes. These are holes basically that helps the olfactory nerve or your sense of a smell to collect data from your nose, because your nose, if you kind of imagine it, is right down below it. So there are many holes. So instead of saying foramen as a single hole, we call them foramina. And again, olfactory because they're associated with your sense of a smell. So again, if you're looking at your ethmoid bone is visible from here and then going up to here. That's where your ethmoid bone sits in the back. And the cribriform plate is right here. Crista galli would be pointing right up here. And the holes that I was showing you would be sitting right here, kind of helping you visualize, hopefully. Okay, now looking at the ethmoid bone, again, that's what I was trying to do you guys earlier. The ethmoid bone is sitting right here. Well, I guess I should expand this. It kind of go like here. And what it includes is this bone right in the middle. So this bone, and it's right below the nasal bone, which is right here. So this is called the perpendicular plate. You have these protrusions on side called the middle nasal concave. And then you have ones on the bottom called the inferior nasal conchaves. Sorry, the conchaves, not conchaves. So these are essential for your respiratory system, which you will learn about next semester. On the bottom of the perpendicular plate, so perpendicular plate ends basically here. So this bone right here, this little tiny bone you see right here, which is connected to the maxilla as well, is called the vomer. So if you imagine this, your lips would be sitting right here. This is the area right above your lips, basically where the mustache will grow. So this bone is right where your area, your maxilla meets right where your nose actually starts. So that's a separate bone called a vomer. Now, associated with your bone, your sphenoid bone, your frontal bone, and your maxilla. You have what we call the paranasal sinuses. These are basically opening inside the skull bones, and they produce a mucus. They are part of the respiratory system. They also help lower the weight of the skull as they basically openings inside the bony structure. As I mentioned, there are 4 sets. And they are associated, their name is associated with what bone they're originating from. So you have the frontal sinuses, the ethmoid sinuses, which is in blue. A little bit below that is your sphenoid sinuses. And as part of your maxilla on either side of your nose, you have your maxillary sinuses. For this, we don't really actually have, even if you were in a class, you wouldn't be able to see these sinuses, mainly because the bones that we deal with are plastic bones, and therefore most of these structures would not be visible to us. Furthermore, for us to be able to see these, you actually need to cut through the bone to make sure that these structures are visible. But if I were to use a regular skull, what I would see, for instance, for the frontal sinuses is these opening and protrusions right here. So basically, if I open or take out the top of the cranium, the frontal sinuses would be right here, which is what I show you over here. Let's see. We looked at these already, just kind of, again, reminder. We have the nasal bone, we have the vomer as a separate bone. What you see in red as a whole, that's your maxilla. And then your cheekbone depicted in blue color, those are your zygomatic bone. I mentioned lacrimal bone earlier to you guys. Now the word lacrimal itself basically means tears. So lacrimal fossa is basically this little opening on the side of your orbital cavity where when you basically cry or you collect tears, those tears travel the surface of your eye from the lateral to the internal or from lateral to the medial. And they basically get drained through this little opening called the lacrimal fossa. So I tell my students, if you want to kind of think about this, think that when you cry, you also get a watery nose. And the reason for that is that extra tears are basically traveling through the lacrimal fossa and get into your nasal cavity and basically drain from your nose. Now, the bone that this hole is associated with it, which is this bone right here, that bone is called the lacrimal bone, which is one of your facial bones. Now, this view of the bone is showing you basically the roof of your mouth. So in this skull, we have gone ahead and removed the mandible and then turn around the skull. So you're looking at underneath your skull and basically the roof of your mouth. So these are the teeth from the top row of your teeth, basically. And this is the roof of your mouth right here. So the anterior, which I'm going to kind of highlight for you guys, the anterior portion of this, the roof of your mouth, which is called actually hard palate, is the continuation of your maxilla bone. Remember, maxilla is basically forming the anterior view of your face, big facial muscle, sorry, facial bone, not muscle. So this basically continues to form the majority of the roof of your mouth as well. And it is called the palatine process of the maxillary bone. Again, it's not a separate bone. It's an extension of a bone that already exists. So I'm calling that a process. And again, palatine comes from palate, basically forming the roof of your mouth. Now, this second part of this bone, which is this portion of the bone, okay, what I'm kind of highlighting for you right now. This is a separate bone. It's not a continuation or a process of a bone. It's a bone on its own called the palatine bone. So please pay attention. When you're looking at terminology for this, if I'm asking you for basically typically the first 2/3 of the roof of your mouth, that's your palatine process. of the maxillary bone. The last 1/3 is a separate bone called the palatine bone. So this is a different view on the facial bone, your maxilla more specifically. I mentioned this earlier to you. We said that there was a hole right below the orbital cavity, so right here and right here. Below, infra-orbital as an orbital cavity, and then foramen as a whole. So these little holes are called infra-orbital foramen, and we said that there is one right up on top, one right here and one right here, called the supraorbital foramen. Next, what we can see here are these little indentation inside the jawbone or inside your maxilla. These are where basically your teeth are fitting into your jawbone, creating a pattern on your gum line. These are called the alveolar margin. They are both visible on the maxilla and on the mandible, because basically you have top row teeth and the bottom row teeth. Going back, I don't know, I think these two slides kind of switched. Right where you have the palatine process, right? Again, this is your palatine process. You have a little opening right between your two incisors, which is your two front teeth, the big teeth. This little opening is called the incisive foramen or fossa. And again, this sits right behind the incisors, which are your two front teeth, hence the name incisive foramen. Next, what we're gonna take a look at is your mandible. So mandible is connects into your skull using the mandibular condyle and the mandibular fossa. So let's just start over here. So mandible has these two processes or extensions. This one that is in the back is called condyle because it's a way for two bones to come into contact with each other. Mandibular condyle fits into the mandibular fossa and basically give you your articulation for the mandible with your skull, allowing you to open and close your mouth. Mandibular notch is this little dent right in between. And then the anterior structure is called the coronoid process. Be careful with these words. We're going to see another word called coronoid process, sorry, coracoid or coracoid process. So make sure not to mistake them. The spelling does count. This portion of the bone is called the mandibular ramus, and this portion is called the mandibular body. And putting these two together, you basically get what you call the mandibular angle. You have a little opening right here called the mental foramen. And then the mental process is that little area, which is basically your chin, where the bones coming together, called the mental process. As I mentioned earlier, alveolar margin is both visible on the mandible and the maxilla. If you turn the mandible around and looking at it from the posterior view, you have two other openings, right here, and these are referred to as the mandibular foramen. Please be careful, mandibular foramens are posterior and the two holes you see in the front is the mental foramens. A lot of times I see my students flipping these two around. This view is the posterior view of the skull. This is your occipital bone right here. These are your two parietal bones, and then on the side you have your two temporal bones. You have these lines that runs on the back of the skull, and on a real skull sometimes it is more difficult to identify these. The top one is called superior nuchal line, bottom one is inferior nuchal lines. It is points of attachment for the muscles of the back to the skull and basically allowing you to move your head posteriorly. It is important points of attachment for the skull to the other muscles of the back. Again, neck. Now, when we're looking at the skull of an adult versus the skull of a fetus, and there are significant differences in terms of first bone development and also some openings. In an adult skull, we don't want to have any openings because the openings imply that basically the external environment can cause significant damage to the soft tissue of the brain. However, in a fetus and even in babies, because their brain is continuously growing and growing rapidly, you do want to have some room for the skull to expand before the sutures are fully formed and the skull is solidified, basically. So these openings are referred to as the fontanelles of the fetal skeleton or fetal skull. There are four major ones that are visible. I think the best one that people actually seen or notice if they have ever been around a newborn is this little opening that sits between the frontal bone right here and the two parietal bones. This is called the anterior fontanelle. An anterior fontanelle is basically, if you ever seen a baby, you have, and if the baby, you're giving him a shower and their hair is stuck to their skull, or if their baby is super hungry, you can actually see a pulsation in that same area. And again, simply that means that there is no bony structure protecting the brain tissue. You have to be very careful with this area because it is a pronounced opening, and any damage can actually cause damage to the brain. So no pushing down on it just because you see a pulsation. I know some cultures have their own things, and I have heard stories from my students that said, oh, you know, if you push down on it, your child becomes smart. Don't do that, guys. It's really dangerous. You want to protect that, and don't let anybody touch it, including yourself. Now, we have one in the back, which is much smaller. This is between the parietal bone and the occipital bone, called the posterior fontanelle. You have two on the side. One right here sits superior to the sphenoid bone, which is this one, called the sphenoid fontanelle. And then right here, again, in the baby, you don't actually have the mastoid process form, but it would have been sitting right here. So this one would have been called the mastoid fontanelle. So there's four fontanelles in children, and posterior, as well as a sphenoidal and mastoid fontanelle. Now let's go ahead and move on to the continuation of the axial skeleton, looking at the vertebra and the vertebral column. We are looking at a superior view of the vertebra here in this picture. Even though the vertebra that you see in the cervical region versus the thoracic versus the lumbar region might be different, and they are different, they do have some characteristics and a structure that they do share. So we're going to go over those structures together. First of all, they do have a bony piece right here. This is a very pronounced bony structure called literally the body. You have the opening that is sitting and right next to it called the vertebral foramen. This is basically the area where your spinal cord passes through, and it has to be continuous from basically the cervical vertebra all the way to the coccygeal region. You have these bones protruding on the side. These two are pairs. They are coming out again off the side, called the transverse process. You have one major one poking out in the back or posterior view, called the spinous process. I tell my students, if you want to visualize this before we go further, you know, if you bend or if you have looked at your children's, I think it's more visible in children than in adults, or if you have dealt with people that might be really skinny, it might be really visible. You can actually see these little circular bumps that goes down the back, and a lot of times when I was kids, we would count them. So basically what you're actually touching is the ends, this area of what we call the spinous process. So it is a continuation of a process called the spinous process, and the end of that bone basically gives you that little circular pattern you see under your skin. Anyways, I'll show you this on a different view. So here is basically what we're talking about if we're looking at a lateral view. Here is the body, again, that bony structure. You have the opening, which is basically where the spinal cord passes through. That's your vertebral foramen. You have the transverse sticking out on the side. You have the spinous process that is sticking out and is always pointing down if you're looking at the correct orientation. You have a paired processes that are pointing upward. So these are pointing outward. These are called superior articular process. And you have two that are pointing downward. These are also, again, to right and left, called the inferior articular process. Inferior articular process. Superior articular process, there are two of those. There are two of these. Two of the transverse process, you can see them on this picture. 1, 2, and then a single spinous process. So total of 7 processes come off of a typical vertebra. Now, I do want you guys to kind of quickly notice this. We have the word called inferior articular facets. Again, facets simply mean the surfaces where the bones are coming into contact with each other. These are basically articulation surfaces. So if the bony part that is sticking out right here and right here, these are my processes, this area right here, this surface that is depicted in white, that's my facet. That's the actual surface. So looking at this picture, here is my process, right? These are my surfaces or my facets right here. Same here. If you're looking at this, this would be poking out of your screen. So these are your superior processes. And then the surfaces right here and right here would be your superior articular facets. Now, in this picture, I'm showing you a cervical vertebra. One of the more visible structure in the cervical vertebra is the fact that they have an extra opening on the paired opening. In addition to the vertebral foramen, these openings are referred to as right here and right here. These are called transverse foramen, and they're found close to the transverse process. So hence the name, transverse foramen. Something to also note, not that I've usually asked questions, cervical vertebra usually have what we call the bifid spinous process. Instead of a single extension of the bone, they actually have 2 of those. Now, when we're looking at the cervical vertebra, which is the top 5 vertebra we have, sorry, 8 vertebrae that we have, the first 2 cervical vertebrae are basically the one that connects to the skull and give you a lot of the motions that are around the axis. So basically the movement of your head. So the first 2 vertebrae, which basically run against each other, give you the motion or the movement of your neck. That being said, cervical 1 and cervical 2 therefore have received their own names, and they're really important. So the C1, which is the one that comes directly in contact with the skull, is referred to as the atlas. It's the flat one that you see right here. And then the second one, or C2, is referred to as the axis. So basically the axis where your head is going to rotate on. The way this works, axis has this little protrusions or process called dens. Dens is going to fit into the atlas. And basically, it's going to either rotate this way or this way, allowing you to create a lateral rotations of the neck to either right-hand side or left-hand side. So hence the name atlas and axis. Again, they're the ones that basically give you the lateral motion of the neck / head. Now, continuation of the vertebral column, the end of that is a bone called sacrum and coccyx. A lot of people know coccyx as the tailbone, but please do remember the actual name. So here's my coccyx right here. This is a fusion of multiple bones together. Sacrum itself is another bone. It's a triangular bone that fits between your 2 pelvic bones. And you'll see that articulation when we talk about appendicular skeleton next. So on your sacrum, you have the following structure. You have this kind of canal that is forming inside the sacrum called the sacral canal. You have multiple openings or holes on either side, left and right, called sacrum foramen, if you're talking about one of them, or if you're talking about multiple, sacral foramina. You have articulation with the vertebral column or lumbar vertebra, I should say. These are superior articular processes you see right there. And it's also right here. So these are the same structures. These two are the same as these two. And then right here, you have these bony protrusions right at the center of the sacrum called the median sacral crest. So that's the posterior view of the sacrum. Now, moving on to your sternum and your rib cage. So a sternum is a bone that basically your breastbone. It sits and protects the heart and also is a point of attachment for your ribs. It is broken down to three separate structures. The top portion is referred to as the manubrium. So it's this piece. You have the elongated midsection, basically this section, which is called the body. And then this cartilaginous end, which is called the xiphoid process. You also have areas where the clavicle joins the sternum. There are two little dips, one right here and one right here. These are called the clavicular notch. Clavicular notch is basically, again, the location when the clavicle and the sternum join each other. And then this central dip you see right here, and you can actually feel that it's right where your neck starts and where your sternum ends. That's basically, you see that little circular or dip right at your neck on the anterior aspect of it. That's your jugular notch. Don't push on it. And then the cartilages that are associated with your rib cage, these are the cartilages called the costal cartilage. The word costal implies your ribs. So costal cartilage simply means cartilages of the rib. Now, when we're talking about your ribs, we'll talk about the structure in just a second. But before that, I want you to be able to distinguish what is considered to be true ribs versus false ribs versus what we call floating ribs. Now, the terminology for this comes from the fact that how the ribs are connected to your sternum using the costal cartilage. If you have one rib that has its own individual costal cartilage connecting directly to the sternum, those are called true ribs. If you have multiple ribs joining their cartilage together, or costal cartilage together, to merge into the sternum, we call those false ribs. And we also have ribs that are considered false ribs, but basically have no cartilage attached to them. And these are referred to as the floating ribs, hence the name. There is no point of attachment, so they are quote unquote floating. So if you look at the first 7 ribs that we have, so look at the ribs. So you have your rib, you have the direct connection to your sternum. Again, rib, cartilage, sternum, direct connection, right? So it's a 1-to-1 ratio, a rib with a costal cartilage. Now, if you go farther down to these ribs right here, 8 and 9 and 10, what you notice is you have kind of a merging of the cartilage together right here, and then they eventually merge with the number 7 cartilage and then come into your sternum, right? But they don't have that individual connection to your sternum. And then the last 2 ribs, which is this one and this one, notice that they basically lack cartilage, hence they're called the floating ribs. I do expect you guys to classify your ribs based on the number. So if I, for instance, I said rib number 7, you should be able to say that's a true rib, versus number 11 would be a floating rib. Finishing up our axial skeleton, talking about your rib, So I don't need you guys to identify individual rib. For instance, I give you a rib and you should say, this is rib number 3 or rib number 5. I don't expect that from you guys. But what I do expect you guys is to identify the following structures. So on a rib, this is the part that actually connects to the vertebra. So that's the posterior aspect. And right here is basically where you will be connecting to the costal cartilage and eventually coming into the sternum if it was true rib or false rib. So at the end right here, we have the head. The little extension is the neck. You have this little bump called the tubercle, which is again points of attachment for muscles. You have this indentation in the rib cage called the costal groove. And then the rest of the bone is called the shaft. So ribs are pretty simple. Just remember these 5 structures for the rib, and then also be able to, again, classify the ribs based on their number. So that is it for our axial skeleton. We'll continue with our next PowerPoint on the appendicular skeleton.